Hello, everyone, and welcome back to our weekly support group. I'm excited to have you here for this late morning event. We are in for a really interesting topic today. I'm really excited to get your feedback on this and to get some good conversation going. Let me introduce our guest speaker for today for our conversation today, and less of a speaker and more of a discussion. So we are excited to have her with us. So we have Christina Hopkins, and Christina is a fifth-year clinical psychology student who is currently with us at the Center for Weight and Eating Disorders, the psychology group we work with. So you may have met with some of these psychologists in the past. So we're excited to have her here, and most of her research actually centers around weight stigma or weight bias. So we are very excited to be able to hear a little bit more about her area of research and expertise. We have a few individuals who specialize in this area of research at Penn, historically and also currently. So we're happy to hear from her today. And as with most for working remotely at this point, we'd like to share a little bit about our pets. So I, for one, am somewhat rooting for a guest appearance from Christina's 7-year-old Boston Terrier, Guster. If we get to see him in this video, that would be fun as well. So we get to meet people's pets in our discussions from time to time here. So that's always exciting. So let's hand things over at this point to Christina to talk a little bit about fat phobia. Is it a fact or fiction? Welcome, Christina.
Thanks, Colleen. Thanks for that introduction. I'm really excited to talk to y'all today about fatphobia, which is sort of an umbrella term for lots of other terms that we'll define and talk about how you may have observed this in your own life or heard about it, and how it might be impacting you either as you prepare for or come off of surgery. Colleen, is this group mostly pre-surgical, post-surgical, or both? Just so
Everyone.
I know.
Anyone who wants to attend, yes,
cool.
is here. And it looks like in the chat we have a little bit of pre, post, everyone from very beginning of the process to some veterans joining us.
Awesome. Great. That's really exciting. So I hope that this is a casual discussion. I do have one sort of formal pause point in the middle, but please feel free to throw your questions in the Q&A box if anything I'm saying is confusing or just contradicts your experience and you want to share what your experience is. I think we could have a really nice discussion around this topic. So let's get into it. What are we talking about when we talk about fatphobia? So fatphobia is sort of like what we call it in colloquial terms, right? When we study fatphobia, we use a couple different types of terms to talk about it. And on the left, you'll see this really big, maybe confusing graphic about how fatphobia or weight stigma operates at all different levels of society, right? So out here, we have sort of attitudes about in our culture, about beliefs about health and about weight. And then all the way in the middle, we have down at the individual level. So let's just get some quick terms out there so we know what we're talking about. So when we talk about weight stigma, we talk about this idea that having excess body weight is basically stigmatized in our society, right? It might lead to social rejection, it might lead to devaluation, it might even lead to discrimination based on weight. When we talk about weight bias, we're talking more about sort of the individual things that happen from person to person. So negative attitudes toward individuals, that prejudice that you might have experienced, or maybe even attribution of negative character traits like stereotypes or blame about your weight. And then we have internalized weight bias, which is when you take all of that social prejudice, all of that stuff that's out in the air about excess weight and the stereotypes associated with it, and it sort of gets under the skin. You apply those negative stereotypes to yourself. That's called weight self-stigma or internalized weight bias. And that's actually my area of specialty. It's my favorite thing to talk about. It's my favorite thing to help people work through. So we'll talk about that the most today. But all of these fall under the umbrella term of fat phobia. It's very, very, very common in our country to observe or experience weight bias. So over 200 million people live in larger bodies, right, in our country. And at least 40% of those individuals report experiencing weight bias when we've collected data from people. And that number creeps up all the way up to 90% of people once we get into the higher weights. So it sort of varies by your weight usually. And then of those people, over half report weight self-stigma. So by our estimations, at least 45 million people in America experience this process of noticing stereotypes out in the world and then applying those stereotypes to themselves. And we'll talk about why that matters in a minute. But let's talk a little bit about concrete types of weight bias, because I want to see if you can call up some memories in your own life or maybe what you've observed happening to others in your life, and see if any of this has occurred. So we might see weight bias in the form of stereotypes. This is very, very common in the media. You might notice that people in bigger bodies are often the butt of the joke, especially in, sort of pop culture. You might experience other people prejudging people in bigger bodies based on incorrect assumptions, based on stereotypes about laziness or willpower, things like that, all incorrect assumptions, right? We also sometimes see weight bias in the medical system, right? Hopefully you haven't experienced that here, but if you have elsewhere, it is quite common, right? Sometimes people experience their health problems being blamed on weight when they're not at all weight related, right? Like breaking your foot or something like that. And we'll talk about how to deal with that. Weight bias also comes through in our environment, right? In structural barriers. So things like chairs being too small or not sturdy enough, seatbelts being too short. In general, the world being sort of designed for thinness, right? So a thin body being the default is inherently weight bias. You might also experience interpersonal stigma. This is usually the first one that comes to mind for people. Comments about your weight from friends or family. You might have stories about sort of quote unquote nicknames from childhood that are actually really stigmatizing or hurtful. You may have experienced social exclusion or seen others be socially excluded based on their weight. So these are all the sort of person-to-person instances of weight bias. And then finally, we have weight self-stigma. So those might be those negative thoughts or self-judgments that are sort of playing on a loop in the background of your mind, right? That can be critical or self-hating, self-talk. It could be feelings of shame, guilt, or blame, or it could also be something called the why try effect. Which if we weren't on a live recording, I would use expletives to explain more concretely. But this basically happens when like you're trying to change a behavior, and then what happens is there's a cycle of shame when you're unable to meet some goal, and then you might get this why try, why even bother, I've been told I don't have willpower, so why am I still trying, right? This really gets in the way of your ability to care for yourself, your ability to stick to behaviors that you intended to. And when I say you, I'm sort of assuming that you've experienced this, but you may not have, right? We might be drawing on experiences that you've seen other people have. So just sort of check out for yourself, like, have I experienced this? Do I think this is a thing? And we'll talk more about that. The problem with weight stigma and the reason why I care about it from from a research perspective, from a human perspective, is it's very stressful, both emotionally and physically. So weight stigma is now conceived of as a chronic stressor. And when we say that, we mean like in the ways that persistent racism is a chronic stressor, or caregiver burden is a chronic stressor, right? All of these sort of daily instances of stigma, discrimination, they build up and they wear down our nervous system. And when our nervous system is worn down, it's really, really detrimental to our health. And it can even lead to weight gain. So there's this sort of old way of thinking, you know, doctors way back in the 60s or whatever, some of them, not all of them, who said, you know, if we just shame people who are in larger bodies, maybe that will motivate them to lose weight. That doesn't work at all, because shame is not a motivator, right? So we see this cycle that I'll outline here, specific to self-stigma, that really gets in the way of your ability to stick to your behaviors that you're, you know, all planning for after surgery. So imagine this. Imagine you have experienced internalized weight stigma or self-stigma. Maybe you have thoughts that play on a loop after you eat something that you didn't intend to eat, or you skipped an exercise that you intended to complete. So maybe that thought loop that's playing in the background is, I'm just lazy and I have no willpower. That's sort of playing into those stereotypes that might be associated with heavier bodies, right? When you hear that playing on a loop, it evokes a whole set of emotions. It might be shame or guilt. It might exacerbate already existing depression or anxiety that you have. Basically, it makes you feel like crap, right? And then what happens when we feel like crap? We're less likely to take care of ourselves, right? We might avoid exercise even more. We might cancel our gym membership if we go to gyms these days. We might be more likely to eat in response to emotions, or just eat more than we intended, eat for comfort, basically. And both of these things in tandem are likely to lead to weight gain. Even after bariatric surgery, it might lead to weight regain, and just, yeah, never mind. I won't go into the whole graph, but it's not good for your health in general. And then what happens when weight creeps back up is we might see even more self-stigma, right? We sort of double down on these negative thoughts, which only get us trapped in this little cycle. But there's good news about weight stigma, and that's where we'll pivot to it for the second portion of this. So what we do know from research is that you can effectively cope with internalized weight stigma to make sure that it's not detrimental to your health, right? You may be able to prevent that chronic stress response, or you may be able to stick to those behaviors even if you are experiencing a chronic stress response, right? So there are some things that are linked to less self-stigma, like self-compassion or positive self-talk. And then there are some things that are linked to more self-stigma, like negative self-talk or disengagement from your social circle, from your goals, self-blame, all of that. So that's what we'll talk about for the second portion. But before that, I want you to just pause and check in with yourself, and maybe even toss into the Q&A if you haven't already. Have you experienced weight bias in your life? Or have you even self-stigmatized? Maybe you've even done it today, right? In general, how has fat phobia shown up in your life and in your social circle? So let's pause there before we move on to coping.
Yeah, so I can give you some of the things that are happening right now, Christina, in the chat. So Jay has a great comment, not a question, but she had said that when others bring up her weight as if they know better than her, I simply reply, if you don't feed me or pay for the food, then I don't care what you say to me. What are your thoughts on this type of affirmative boundary setting that Jay is talking about?
I think that's really great. What I love about it too is that there's a little bit of levity to it, right? You can bring a little bit of humor to this process so that it still feels like something you can talk about with people. One of the coping strategies we'll talk about later is to set boundaries and be direct with people. And everyone has different levels of comfort about how direct we want to be, and that might change based on who we're talking to, right? So I would encourage I would encourage everyone to really just practice saying things like that, right? Like, this is my body and I'm caring for it in the way that I know how, right? Or even maybe saying to someone, I know you think that that's helpful, but it's actually really harmful to me, or something like that. And we can brainstorm a bunch of different ways. But I love that direct attitude and clear communication. I think is really, really wise.
Excellent, excellent. And so we have a few other comments around being more aware now that they're going through this process of the stereotypes and biases that are out there. And we have one from an anonymous attendee right now that I really strikes home for me, because this is where a lot of my work is within Penn medicine, is around structural barriers and built environment. We've heard a lot about built environment in here. They had mentioned the airplane seatbelt was one of my final straws pre-op. I had to ask 3 times for an extender, as if once was not enough. Once my upfront safety was at risk, I really knew I had to make a change. And I'm wondering if you have any comments to this, Christina, about not only the interpersonal interactions, but really built environment is not set up to be very weight inclusive.
Not at all. And that is why one of the things we'll talk about at the end is also about advocacy. I think some of the greatest success stories I've heard in people's journeys with their own relationship to their body and their weight is when people really develop a passion for advocacy in this space. It can be really, really empowering and also impactful in their environment. So, airplanes and things like that were designed for thin bodies because very likely the people who designed them were thin people, and they were just thinking about themselves, right? That's how a lot of design works. And it's not malicious necessarily, but it does need to be corrected, right? So we have a lot of wiggle room. We can write letters, we can make phone calls, excuse me. And I will show you 2 organizations at the end of this that are doing advocacy, that are even changing policies on the state level or national level. So every time you engage with something like that, you have a choice about how to respond, right? I love that you were persistent and asked 3 times. I'm sorry that you had to ask 3 times, right? You would think that they could just put one in the back of every seat. So maybe we could think about writing a letter to that airline, and asking for a simple change and describing how it would be impactful for you. Yeah.
So Christina, 2 different items. One is thank you for coughs happen, but thank you for modeling for us during pandemic times how to properly cough in your elbow. I love it.
Sure thing.
The side of me is swooning right now. Thank you. So 1, 2, we have a few different comments around, unfortunately, some negative comments around individual size. So we have from Renee, I have all the bias in my everyday life, whether it be at home or at work. Example, I was at my niece's communion party and I got up from a lawn chair and it broke. My mom kept saying loudly that you broke the chair. All I could do is say thanks, Mom, and hide in a room. Didn't want to come out for the rest of the party, and it couldn't stop crying. We also heard from Ellie, that on a plane, a young lady told her kids that she was fat, and you never want to be fat, using it as a lesson. So we're hearing about these comments from others, almost using someone's weight and size as a negative attribute to them. Yeah. Do you have any comments for Renee and Ellie here?
Yeah, first of all, thank you for sharing those experiences. I know this is a really personal topic, and it can be painful to bring up these memories of, just really hurtful moments. And they're so common, as I think is evident here, right? That story about the chair really strikes home for me. A lot of my family members are, all different body sizes. And I grew up in a house where it was very common to, my uncle would always grab a particular chair that he liked because it would support him, right, when he would come over. And he really had to learn how to find the correct environment that would support him, right? So it's just sort of breaking my heart that happened to you, Renee, and that you were crying for the whole day. I want to talk about the importance of coping strategy, because I think what this highlights for me is everyone in this room, in this, virtual room, has had so many experiences that are like this. And when I talk about weight stigma, I get a lot of feedback from the more like academic people who say, like, why are you teaching people how to cope with this on their own, right? Why is it my problem that I have to fix? Why are we not working at the societal level? And my answer is both, right? Like, I hope that, Renee, that you can learn some tips today so that if that ever happens to you again, which I hope it doesn't, then you can use some quick coping strategies so that you can still be at that communion and enjoy it fully, even with those negative experiences that might still show up, right? So I think that's the next place I want to go, so that you are empowered to be able to engage fully in your life, even when these sort of biases are out there coming at us, Do you think, Colleen, we can pivot to the coping part and then come back to the Q&A?
We can. I do want to highlight two different comments here before we do, because I think they'll come into play with the advocacy and coping part. So one thing that I've noticed that you've been very strategic about is that this isn't obesity bias. It's not obesity stigma. It's weight stigma. And the reason why I want to call that out, that we're being careful about our language and really being cognizant of it, because we have Margaret here saying that she's now having people tell her that she's too thin, that this isn't just about generally being on one side of the spectrum, that weight stigma is all along the spectrum. So acknowledging that, I want to call that out. And one other item, we do have some conversation here from Anonymous around discrimination, legal discrimination. We can come back to that in advocacy, but keeping in mind that there's only one state currently that explicitly prohibits from a legal standpoint weight discrimination, and that is Michigan. Yep. Massachusetts has a bill currently proposed, but that is it. So we can come back to that for advocacy, but I do want to highlight those as the things that we might want to discuss later on.
Yeah, that's really helpful. Thank you. I'll note that for when we get to the advocacy part. Okay, let's keep rolling, because I want us to make sure we get through everything. So I think I already kind of summarized this, but just to highlight again, like, why do I care about coping, right? Why do I talk about it? I think that coping is the best way to empower people. In short, right? You can think about it like the moat around a castle. So we all have this idea of our life and things that we want or things that we want to do, right? Like, maybe I want to stick to this eating plan so that I can have the best outcomes from my bariatric surgery. I want to do that in a way that supports my health, that doesn't lead to more shame. And I want to do it so that I can live long and see my grandchildren grow up and all that stuff, right? All those good reasons. So you have all these ideas about a life. Then you have this moat around the castle, and you have to cross the moat to get to the castle, right? But usually in the moat, there are scary things. There's alligators, there's monsters, whatever. Or in real life, there's shame, there's guilt, there's all these bad sort of feelings. So usually what we do when we get up to the moat of bad feelings is we turn around and we run the other way, right? But what we actually need to do is find a way to cross the moat of bad feelings so that we can get to the other side, so that we can get to that full, rich life that we designed, right? Viktor Frankl, who wrote A Man's Search for Meaning, he said, between stimulus and response, there is a space. And in that space is our power to choose our response. And in our response lies our growth and our freedom. And this really summarizes for me why I think coping is really important, right? I can't make society's beliefs about bigger bodies go away overnight. I wish that I could, but I can't. So what I can do in the meantime is teach people how to respond differently so that it doesn't have so much of a negative effect. This slide has a ton of words on it, so feel free to screenshot or whatever, or we can distribute these probably after. But let's talk about specific different kinds of coping. Now, we already talked a little bit about being direct with that lovely example earlier. So you can set boundaries with people, let people know what kinds of comments are and are not okay. You can even have this conversation before surgery, right? Like you might say, hey, you're going to feel an urge to comment on what I'm eating in a way that you probably think is helpful. It's actually really getting in the way for me, right? You can use I statements to communicate your feelings. And there are specific examples on the next slide of like things you can say. You can also do what I call check out your thoughts. So a lot of us sort of just take our thoughts as facts, right? And this might be a little bit abstract, so just hang with me. Our thoughts are not facts. They're just kind of like what our mind is doing at that time, right? All the time we have thoughts about things that are scary or whatever that are not necessarily based in truth. So you could say, I notice I'm having the thought that blah, 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 which is different from just having the thought. It gives you a little bit of space between you and that thought, a little bit of space to check it out and see like, is that really true? Or is that just an old habitual thought playing on a loop? You might even recognize what I like to call borrowed voices, which are maybe things that people said to us as children that now we are sort of repeating to ourselves on a loop in our mind, not on purpose, right? But that can just be sort of what happens. What you can do in response to these is practice responding to negative self-talk with positive self-talk. Things like, I'm doing my best. Or if you feel like someone is laughing or judging you or something like that, saying, I can't read their mind and it's actually very unlikely that they're looking that closely at me, right? Or practicing gratitude. My favorite coping skill in this area is building self-compassion. My dissertation research is an entirely self-compassion based intervention targeting weight stigma. And that's because it's good for us in lots and lots of different ways. It's good for us on the nervous system level. It's good for us emotionally. So you might want to consider building a daily self-compassion practice of some kind. And that could just be like using compassionate self-talk, like, may I have peace? May I be well? It could be daily mindfulness practices, which I'll give you some specific links to at the end, but Tara Brach and Kristen Neff are really good ones for self-compassion. Self-compassion is really just talking to yourself like you would a small child or a close friend, right? We're much less likely to be harsh with other people than we are with ourselves. So you could practice treating yourself with the same kindness that you treat others. We could also go to the nervous system level, right? Remember I said that weight stigma is conceived of as a chronic stressor, and that impacts our nervous system. So you could do some paced breathing exercises. I'm thinking this would be really useful at the communion party example, just to go into a room for a few minutes and do some breathing exercises. And if you count an inhale for 4, and then hold your breath for 2 counts, and then exhale for 7. That long exhale is what soothes our nervous system. It just sort of turns down all of our natural calming mechanisms. Engaging in daily movement or some kind of physical activity is also very regulating to the nervous system, and so is practicing gratitude. So doing either gratitude focused or compassionate body scans, thinking about what your body does for you all day. Like, wow, I have these lungs that are breathing for me, these legs that take me from place to place, these eyes that see so clearly, all of that we take for granted, really. And then for advocacy, there are 2 organizations that I'll link to, the Obesity Action Coalition and the Rudd Center over at University of Connecticut. They are sort of on the front lines of policy changes. So when it comes to legal discrimination, for example, the folks at the Rudd Center are very involved in trying to make discrimination on the basis of weight illegal in every state and nationally. So you're totally right that there's only that one state where it's illegal to discriminate based on weight. And there are lots of people petitioning for that to change. So if that interests you, if you like to get involved with policy changes, definitely check out those 2 organizations. There's ways for you to get involved directly. or be inspired about how you can get involved in your local government as well. And you can also be an advocate in those like smaller daily ways, right? By doing any of these things, by standing up for yourself, by standing up for others, by pointing out weight bias that you observe in the media, especially when children are around, by just sort of helping them to unlearn what society may be teaching them about bigger bodies, and all of that. Let's talk about some specific things you can say, because I find that for some people, it's just like, I don't really have the words. I'm not exactly sure what to say. So I would encourage you to practice saying some of these things in the mirror, right? So if you hear jokes that are about negative stereotypes about weight, you could literally just say, I don't find that comment funny. You could actually stop there if you wanted to, but you could go on depending on how much you want to explain. You could say, I feel like it makes me the butt of the joke, or you're treating my body as something to laugh at. When you make jokes like that, I feel hurt, angry, and invisible. It makes me feel like you don't care for me. So the things I want to highlight why this might be a useful way to respond is it uses I statements. You're clearly communicating the impact of somebody's words on you. You're clearly labeling your emotional experience and explaining how it's impacting the relationship. Some more examples, if you experience medical bias, to just ask directly, can you explain how these symptoms are weight related? Could you direct me to more reading, or even asking for a second opinion? Basically just feeling empowered to take charge of your medical care, ask questions, and ask for other opinions if it doesn't sit right with you. For structural barriers, we talked about already, but basically advocacy is the way to go here. And that can literally just be writing an email, right? So writing an email to a bookstore that has only chairs for thin bodies, just find the email address online and say, hey, I noticed that none of these chairs would be supportive to my body. Let me tell you how that makes me feel as a patron, and let me make suggestions for how you can change, right? That's a nice, gentle way to just open people's eyes and spread awareness about weight stigma and how they might be excluding people in larger bodies. For interpersonal stigma, we kind of already talked about that, but it's similar to stereotypes. I'm sure you're trying to be helpful, but your comments about my weight only make me feel shame and guilt, and they don't motivate me to take care of myself. And then for self-stigma, the process really begins with just noticing that you're doing it, right? Noticing that you might be stuck in a thought loop, because that's the only thing the mind knows how to do sometimes. So then practicing labeling the emotion. I'm feeling sad about my weight. I'm doing my best to take care of my body and my mind during this journey. So basically just meeting yourself where you are, labeling what's going on, and treating yourself with kindness. I will share these rather than go through all of these, but there are just some specific organizations that I mentioned, and then podcasts and books. So if thinking or talking about this topic is new to you and you want to just sort of flesh out your own ideas a little bit more, or learn more about how it might be involved with intuitive eating or all of those sorts of things, then these books and organizations are a good place to start. So we can open it back up for Q&A to finish out. And I'll leave it to you guys because you have lots of good questions.
Excellent. All right. So first off, Christina, I do have to say I'm going to switch with you here for a second. I have a whole bookshelf behind everybody that you can't quite see. And I was very excited that some of the books that I haven't pulled off the shelf since I initially read them years ago, including Viktor Frankl, which like I never hear about anymore, you pulled
Really?
in. So
yeah.
I love the references. Okay, that's me geeking out on philosophy and psychology there. But let's talk a little bit about what's happening in the chat function here. So we have from Jay, who's looking to advocate for herself to change some laws, but especially around life insurance, to be able to leave something for her adult children or her grandkids. I had suggested that she go to Obesity Action Coalition. They work alongside, it is the There are multiple other partnerships that they've created with some of the different professional groups to be able to leverage some resources to be able to push for change. Also, we have from Raquel, therapy. I am my worst critic. However, therapy helps me retrain my negative self-thinking. Christina, I know this is a loaded question because you are a doctoral student in a doctoral candidate in psychology, but tell me about your thoughts when it comes to therapy and especially internalized weight stigma.
Yes, I think it's definitely the way to go. The only reason why I didn't include it on my resources is because everyone that I talk to is so tired of me recommending therapy to them. So I thought I would take a break for a minute, but you're totally right, Raquel, that it is so helpful. And there's only so much information that you can get from a quick webinar, right? But in the therapy room, week to week, you can really do basically experiments with your own life, right? With examples with your family members or the built environment that you're living in, and test out all these different coping strategies and unlearn all of your own internalized weight stigma. And that is an ongoing iterative process, right? Sometimes it can take, a full year or longer to really undo some of the things that you've probably been learning for decades. So I'm a therapist in training. I love therapy. I think literally everyone on earth would benefit from a little bit of therapy to learn a couple coping skills and just feel well, right? So thank you for that plug, Raquel. I appreciate it. I think it's really helpful.
Excellent. All right. And then we also have in here from Anonymous responding, saying that avoiding toxic people or environments is sometimes best. And I have found that being direct does not work with some people. I have identified healthy and unhealthy relationships with people based on affect. So, Christina, how does somebody actually determine what approach is going to be best in that situation, right? The idea that when you have a hammer, everything kind of looks like a nail. When do you know that you need to switch your tool?
Right. That's such a good question. Thank you. And I appreciate that toolbox metaphor too. So I think you're totally right, Anonymous, that being direct does not work with all people, right? And that is something that unfortunately you kind of have to learn from experience, right? So this is what I mean when I'm talking about behavioral experiments in your own life, is these are all ideas of things you can try. And now you have to actually go into the world and collect some data, right? So you can sort of read this list and check out your own gut instincts. Which of these feels most authentic to you? Which feels most like your personality type? I'm sort of I'm a direct person. I'm going to tell people what I think because I'm from South Jersey, right? So, but that's what works for me. It doesn't work for everyone. So you by no means are under pressure to be direct with people who it doesn't feel safe or secure to be direct with, right? For those people, you might have to really work on regulating your nervous system when you're around them, right? Maybe you meditate before you see them so that when you're actually engaging with them at dinner or whatever, you can just sort of let their comments and thoughts flow over you, right? Like they bounce right off. So you can work on regulating yourself rather than trying to correct someone's behavior if that feels like what fits the dynamic, right? And you kind of know who those people are in your own life, like the people who you just kind of have to, accept what they're giving and be compassionate for them. That's the best they can offer. And for some reason, I've chosen to be at dinner with them, so I'm going to regulate my nervous system, right? So I think you really have to go by gut instinct first, and then just start trying stuff, like behave all over the place, do it all and see what works. And maybe even compare notes with someone else who's also on this journey, right? Like, oh, I tried building a self-compassion practice. Here were the barriers that I came up. I actually felt really uncomfortable when I practiced self-compassion. Or I tried to meditate and my dog came in every 10 minutes. Like, what do you do? So a lot of it is just testing it, collecting data, and testing it again over and over again to figure out what will be best for your toolbox, because everyone's going to have their own set of coping strategies that work best for them and for their environment, I think.
Excellent. All right. Well, Christina, we have one last comment that I'm going to use to wrap things up, and this is going to get a little bit into the public health weeds. So if you don't mind me taking this one on, and we'll do wrap up. So we have here of how do you change the quote unquote normal standard of weight? Some are just not realistic. Am I wrong? And many discounts go by these ranges. So this is something that's one slide in our information session that I think, although we talk about in the beginning, we don't always come back to. So how we get the diagnoses for different weight statuses for classifying someone as healthy weight, quote unquote, having overweight or having obesity is based off of body mass index. And it's based off of epidemiological studies. So looking at long-term, someone's body mass index and their risk of mortality, the risk of death. So this has been repeated, let's say, with hemoglobin A1Cs for diabetes and risk of mortality. So that's where we get that cutoff of 6.5 for that, right? Is to look at what level does risk really shoot up. Similarly, we do that with blood pressure to get cutoffs for hypertension of what those diagnoses are. And weight for diagnosing obesity is no different. So we see it really spike up in terms of risk of mortality at about a BMI of 35 for most US adults. So in terms of weight goals for individuals and BMI goals, we typically end up talking about just lowering a body mass index to lower the risk long term, just like we would talk about lowering blood sugar or lowering blood pressure. And we focus more on that being the outcome and focusing more on what are the behaviors and the things that you can change or the treatments that are available to help bring that risk down, bring that level down. Now, that does not mean that everyone would be healthy at having a BMI under 35. That doesn't take that into account. When we talk about epidemiological studies or large population studies or recommendations, it's not exactly for the individual. So one thing that we talk about is what's the healthy weight for you? And weight management treatment doesn't always mean weight loss, right? Obesity treatment might not mean weight loss for an individual. So for those types of quote unquote standards, one thing is that we're trying to get away from calling it normal weight because it's not normal per se. It's really talking about risk, right? One. Two, for many of these programs, they can discriminate based on weight because they're allowed to. There are certain areas that's okay in terms of talking about health management, but if it's something that's around your benefits for earning points or cash back for your insurance, at least one time a week when seeing patients, they have forms for that. If it's not medically recommended for you to get down to a body mass index of 25, because your BMI used to be 60 and getting down to 25 may be an unhealthy weight status for you, I fill out a form, right? That's something that we can also provide you documentation for. So reach out to us about that. We can help you work around that. But part of the way that we are able to use those risks and those diagnoses appropriately is talking about them in a way that we're really talking about what we mean. It's clinical risk, right? Just like with hypertension or diabetes. If there's evidence to say that we need to change those from a research standpoint, then we'll change it. But it's also talking about it in terms of weight status, not as a normal weight. It's really risk level. So I know it kind of got into the weeds on that. I'm more than willing to discuss with you off to the side a little bit more, and I'm sure Christina is as well. I know there's a lot of debate within that. And how we look at body mass index long term as well. So always enjoy having that conversation and challenging people to think about this really in a new light and being able to help you with whatever your goals are.